I was having all the symptoms of a heart attack in 2022. Cardiologist did a heart cath, arteries clear, arteries were spasming, causing that feeling.
Mhm.
2023, Geraldine came across Dr. Vadia, started eating carnivore, good show. After eating plant-based with chicken and fish for the past 20 years, how do I know that my arteries are still clear? How long should I wait to have a CCTA scan? And how do I know the pain is still spasms and not clogged arteries?
Yeah, so that's a great question. Some generalities, I'll talk around that. So, coronary spasm. So, again, let's go back. Let's actually go back a step. What is a heart attack, right? A heart attack is when the muscle of the heart, right? The heart is a muscle, is not getting enough blood flow to meet its requirements. The heart is filled with blood, right? But it can't draw oxygen and nutrients out of the blood that's in the chamber. So we have these arteries on the surface of the heart, the coronary arteries that deliver blood flow to the muscle of the heart. And if we're not getting enough blood flow, that's what causes a heart attack. That can be due to a blockage, most commonly. But if the artery temporarily spasms and shuts down, that could also cause that reduction in blood flow. And this is a less common condition, but it's not unheard of. Why does it happen? Not quite clear, but it seems to be some sort of either you can think of it as a hyper nervous reaction, right? There are nerves that control how big and how small our blood vessels are. And if you get a sudden spike in maybe something like cortisol, epinephrine, that can cause these blood vessels to spasm. We don't really know for sure why some people get this. So, if it's been determined that's what causes it, and you didn't have plaque, let's say 5 years ago, I think the question was when that happened, how do you know, do you have plaque now? I would start with a coronary artery calcium scan, a CAC scan, and see, do I have a lot of plaque now or not? If your CAC score is elevated, or you really want to know more detail, the CCTA, or a coronary CT angiogram, gives you a more detailed look at the arteries of your heart. The downside of the CT angiogram is it's more radiation and it costs more, but it can be a good option in certain situations. But I would typically start with a CAC scan first.